I guess just at the moment, probably more at a practical level, in terms of what's existing now, we usually suggest that there is actually a site in Switzerland called OnCode. If you just Google HONCOD, that's called Health on the Net Foundation. That's a third-party organisation, non-for-profit, that accredits health information sites to a certain level of standards. They inspect sites every year. They have a searchable database, and if a site has been accredited to that, they also get a logo that they can put on their site. So just at the moment, I think that can be quite helpful. That's mainly for information sites. And they upgrade their standards every year as things emerge in the place, so that's pretty good. And then there's also Beacon, I guess, if you're looking more for the sort of treatment type of interventions. But yes, I agree with David. I think it's huge need, isn't there, for something a little more organised. I think also the problem with things like OnCode, and also there's a Better Health, the Australian one, which is run by Health Direct. They tend to evaluate sites based on quality, generic sort of quality indicators for health. But you guys are actually probably more content experts, so they don't necessarily look to see whether they have what you need to tell people about cannabis, for example. So that's the downside of those ones. But those are the two areas we suggest.
I think it's really quite important to know that when we looked at the alcohol and other drug sites, including some of the really prominent ones in Australia, the information that we saw was actually good quality information, but extremely poorly expressed. The language was far too complex. It was very, very clunky. I think we need to be very careful. You know, everything we put on our website can't be any more than Year 7 reading level, and in fact most of it's Year 4 or 5. And I think we need to be thinking not about tertiary people reading this.
Yeah, look, I don't know if there's an actual sort of time frame that you could put around it, but absolutely for young people it's critical. And what we find in a lot of our engagement with young people is that they sort of can see the benefits of a lot of the online interventions that are out there, but don't sort of see them as being super engaging. But then the challenge is that you go the reverse and you make it super engaging, really high quality graphics, and the clinical content isn't there, and that's a challenge as well. I actually think it's about user-generated design and how you work with the target group to create these services. And you know, looking at the different interventions that are out there, that really is what people are doing. So whether that's going down the traditional route of doing focus groups to inform the development of a service, or actually using you know, different methodologies for user testing, it's absolutely critical. And then I think the next challenge is around how you then make use of social media and other online environments where people are to constantly promote and engage people in your service. So, you know, probably most of my experience has been with the youth mental health service reachout.com, and you know, the website itself has brilliant content, variety of formats, but more importantly links back to Facebook, Twitter, YouTube, etc., to actually disseminate that content out to young people who may not actually type in a URL of reachout.com. So I think, and that's going to be the challenge with the portal as well, is, you know, how do you promote the portal so that it's actually out there for people in the community. I can comment really quickly and then pass the microphone down, because one of the things that I actually looked at in my PhD was the use of technologies within the youth health workforce, and one of the biggest barriers to people being able to access good quality content around a whole range of issues, including gambling, drug and alcohol issues, eating disorders, self-harm, was filters that organisations had put in place that were sort of diverting people away from what was really good quality information. So I think from my perspective, it's a significant challenge, and I think we need to work with governments to ensure that it's actually not going to reduce people's access to good quality information, because at the moment the filter that's being proposed doesn't seem to be able to distinguish between information about gambling help and information about gambling sites online. So it's a big challenge.
Just to say, I think you're absolutely right, and certainly even within the education system, at least in New South Wales, school kids doing school projects in class can't access anything on alcohol or other drugs, or Facebook or YouTube or those sorts of things. So we do need to think really clearly about it and have a government or a team around developing the filter who's actually prepared to go in and look at the content of the site and not just the keywords that might pop up in a search. I know that CRC looks pretty amazing to me. I guess my dreams in particular come back to funding and having the infrastructure and the security that brings, being able to then go and work at the interface with the IT experts as well as the content experts in keeping ahead of what the next technology is going to be, and being able to modify and adapt our content to do that. But that takes time. It takes having like-minded people in the same room at the same time, or same cyberspace at the same time, and certainly ongoing funding and infrastructure to support that. My feeling is that with the increasing use of smartphones, that'll be a really important technology and platform on which these sorts of services are developed. So people sitting on the bus getting their therapy as they're going from place to place. And I think we need to be on top of that, and think about how different that kind of a platform and environment is to someone sitting at home on the internet doing those sorts of things as well.
In terms of the research, I'm actually quite keen that we don't just become technology lovers for the sake of it. I'm really keen to see this actually developing interventions that are not only more accessible but actually work better. I think we have an opportunity here for treatment in the natural environment that has really never been available before in the same way. I think it is just so exciting, that possibility of what we could do with that. So I'm interested in those sorts of questions. I'm working independently in this, in looking at a better motivational intervention than what we've got now, and one that can actually have more bite in the natural environment. And so that's the kind of thing in terms of the research. In terms of the actual interventions, we need to be thinking about the new things that are going to be emerging. Look at what's happened in the last 5 years. It's really hard to predict what the next wave of things will be and what their opportunities will give. We're interested in multi-platform things, and we're interested in ways of developing shell programs so that we don't get caught up quite so much in the actual nitty-gritty programming stuff, and can move on to having better interfaces and better content.
I guess just speaking in terms of gambling just for a moment, one of the emerging areas is being able to put a bet on anywhere, anytime from a smartphone. And we're certainly looking at ways that we can integrate an intervention into a place where people can gamble. So, and it also builds into the question of is counselling on a bus counselling? And if you can put a bet on those. Has anyone been to the MCG this season? They have odds on the scoreboard. So a person can be putting a bet on surrounded by 100,000 other people. Is that the time where we want to intervene? And if we're intervening, what sort of intervention is it? And so it starts to raise questions around, what sort of treatment are we doing? What is therapy online? And it maybe goes back to the point of before, where a therapist isn't so helpful in a lot of the studies, but maybe it's actually what we're doing that's not so helpful. Yeah.
I think just listening to a lot of the talks today and just generally from the area, one of the things that excites me about it so much is the diversity of different interventions that are available. And I think one thing my clinical experience has taught me is that diversity is so important for different people, different times in their life. So I guess my dream would be in 5 years that we still have the diversity, but it hasn't all got narrowed down to 1 or 2 programs. But also then that we have, as Dad was saying before in relation to the information, we have infrastructure that allows people to find what would be good for them. So, and then the other dream I have is the potential for actually improving some of the therapy we do, perhaps by adding in some of these resources, because I think overall, a lot of the therapeutic effects that we get are perhaps not as strong as we'd like. So that would be my other dream, is we can seamlessly add value to what we do.
Yeah, and I guess following on from that, ours would be that every healthcare professional or professional supporting young people has access to these resources as part of their toolbox of things that they use to improve wellbeing for young people. There's a real issue, I think, around awareness of a lot of these absolutely fantastic services that are out there. So building that awareness and giving people the skills and resources to be able to use them well, I think is really important.
Sorry, we missed you.
Nice to listen. I dream about two things. One is the NBN, obviously. Fat pipes is an opportunity then to move away from text to other ways to impart information. I think it's very exciting. The second thing that I dream about, and it's just a dream, is funding being directed to develop infrastructure in technology, as well as programs. So developing the underlying infrastructure that organisations can then pick up and template. I think people work in groups that aren't necessarily homogenous, and it would be nice to have open source or Creative Commons resources available because a lot of us are working on the same thing. So let's get together, build one, make it available that others can take and adapt to it. That's my dream.
Why are you looking at me? It's cooperative. Everyone's responsibility.
Yeah, I think that is the answer. I mean, that is the answer. I mean, it's a collaboration between people, and then if we're cross-listing stuff, it's going to be easier for people to see where to go.
Absolutely. Yeah, look, it was interesting, and this is again in the mental health context, but in my PhD research, I spoke to people in youth health services around how we could build their capacity in this area. Unfortunately, what they wanted were email newsletters and face-to-face training, neither of which are actually particularly cost-effective ways of being able to promote and integrate these services. But I think it really is about kind of creating those services that are able to link people into what else is out there. So making sure that, for a service like reachout.com, it includes all of the links into the ANU content, the QUT content, the Shade Project, all of those sorts of avenues. I think it's really important. I also think that there is a role for these interventions to be supported within university curricula, so that people coming out of university trained as psychologists, social workers, TAFEs as well, in terms of youth work and drug and alcohol qualifications, actually have access to these resources from the start, rather than something that we're trying to add on further on down the track.
And just to add to that, I guess as researchers we're always looking to services to take on board innovation and to adopt our treatment manuals that we evaluate and rigorously test. But I feel as researchers, and particularly in this area, that it's also our responsibility to make it as easy as possible for the time limited and resource limited practitioner to be able to very easily run with these sorts of programs and pick them up in the course of their clinical practice without necessarily having to change too much the way in which they would ordinarily work with clients. And I guess that's what's been nice about seeing the presentations today, is that there has been that workforce component to a lot of the websites that have been spoken about that can sort of facilitate that. So.
Yeah, just behind Dan.
Can I just plug there is a technology working group for the AOD sector on Heads Together. I just thought I'd put a plug out there. Heads Together Social Network, we do have a technology group where we do discuss those things as well. So I encourage you to join Heads Together.
The other thing to say is that you're lucky down here in having good access to the Swinburne group. Now, one of the things that I think is really quite important that it is, as therapists, using some of these electronic technologies in your clinical work does actually require some different skills. And one of the nice things about what they're doing at Swinburne is training people in how to do telephone-based counselling that can sort of integrate with the online programs. I'm really sort of getting frustrated with the process because I keep on talking about it to every group I go to. I say, look, guys, you can use this in your work. You know, it's free. You can, and for people who are not in this field, you know, in mental health, there's some alcohol and other drug stuff. They can get into that and they can actually be working with clients. It's almost scripted, you know. You can be working with a client across the desk and have some confidence you're doing something which is evidence-based. And yet we've only got, less than 40 practitioners have signed up. I don't know. Now, look, it's partly our fault. And one of the things that we haven't done yet is create a much more practitioner-friendly site. So at the moment, all practitioners just use the same site as the clients. We need to show them how to use it, how to navigate around it easily. I don't know, do you remember there was, I've forgotten who did it now, there was a really nice CD-ROM DVD thing that was done a few years ago on comorbidity for GPs. Brilliant stuff that they had on it. And GPs didn't use it because they couldn't find their way around it.
And I think, it's a bit of a bad way. But so the drug and alcohol services that I've worked with in New South Wales are so keen and see the need for something like Shade or On Track and so forth. But their own desktop computers don't have access to printers or, you know, to the internet, and sites are blocked and so forth. So I think that access to technology is one of the, you know, glaringly obvious hurdles that we need to tackle. It can be overcome relatively easily, but we were getting, you know, 10-year-old computers crashing because they couldn't access particular elements. So I think that's one thing as well.
Just as one last example, I mean, in that work I was talking about with the drug diversion program, they're concerned about some of the sites actually not having internet access. You know, people are going out into a remote Indigenous community to do this work. They might be able to get a laptop but not online access. So a really simple thing that we're going to do, we're going to give it to them on flash drives. They can put it onto their hard drive, and then when they get back into their centre, it gives them a message saying connect to the internet at that point. That enables the information to be registered on the internet from the interaction that they did with the person. So I think we need to be a bit more creative about how we overcome some of these interim hurdles. They won't be around probably in 5 years' time. But right now we have to help people through this kind of barrier.
We got there eventually.
Yeah, so the one service that does come to mind is actually one called Between the Lines, which was developed by the Inspire Foundation and the Ted Knopf Foundation. Is now sitting with Ted Knopf.
But that's not really going anywhere.
No, but I think what they were trying to do with that service, and it's probably the concept which is important here, is actually create an environment where some of the social and cultural issues around drug use could be discussed. And so, you know, some of the articles were around things like sniffer dogs at dance parties or...
I wrote that one.
Yeah, fantastic, there you go. So all of that, those sorts of social and cultural issues that people are interested in before they kind of get to the point where they go, oh, actually, I'm not feeling so good about the way that this is turning out for me at this point in time. I think for us in the CRC, we have a stream of work that is actually around digital content production and content creation. And I actually think that content production driven by young people is a really fantastic way of exploring some of the social and cultural issues, and then linking them back into services at a much later point in time. So you've opened up that conversation. I think that's also where social media comes in, and having a positive presence within online environments, even if it's not overt, to at least have it there so people can go, okay, I might just check that out and put my toes in the water and see what that might mean for me.
We've been struggling with this in other contexts. I mean, if you're talking about a smartphone app, you don't, or you just, it has to be something which is attractive you want to download. So what we're very keen to develop is an app which is about looking after your mates. Because we see that as being a really great way of actually engaging people. So, you know, if you're thinking about the alcohol and other drug use of your friends and their safety and so on, in order to look after your mates, you've actually got to be somewhat in control of your own alcohol and drug use. So we're just trying to think of ways that we can actually do things that will be attractive to people but will be engaging as well. In the context of another thing, that we're involved also with something called The Desk, which is going to be coming out shortly, and it's for tertiary students. It's not available yet. You can watch this space in about 6 months' time. And it will be progressively rolled out in tertiary institutions around Australia, beyond Blue funded. We're looking there at why would a student get into the site and interact with it? Well, there what we're looking at is student well-being. So there we're looking at sort of critical things that students seem to be saying are, you know, important to them. And what's important is, you know, things like, you know, I can't concentrate on my essay's late, I'm really worried about my exams. So we're looking at sort of critical things like that that are not necessarily directly about the thing that we want to be working on, in this case, distress, anxiety, and so on. But in the course of doing that thing that they are keen to work on, we can actually draw that in. So it's a matter of trying to work out what are the things that are of concern to the group that we can use as levers.
I guess something I thought of was just sort of online outreach, I guess, going to places where people already are, where they're already talking to each other. I mean, obviously, you know, going to YouTube is one way of doing it, going to Facebook. Rather than needing people to come to you, you go to them, and that's something that works, I guess, in the face-to-face outreach area.
Yes.
Any comment on that, right?
Absolutely, no. You and I talk about this a lot.
Yeah.
Yes, we ask a lot when we expect people to come and use our service. We should be going to where they're at. We should be on blue light as Morwental, as a pseudonym if you want to, but yes, we should be going to where those discussions are already having, and having open, frank, evidence-based discussions about how to use drugs more safely, how to keep doing what you're doing but in a safer way, having a discussion about that, using peers' knowledge and experience, and using the language, just getting involved in those discussions. And when you do, it's a two-way flow of information. We learn a lot. We develop relationships. You know, Monica knows it, especially Monica, more so that I've tried. But to have a presence in those sort of forums is hugely beneficial in both ways, and you learn an awful lot. And I think the small bit that you can do there is very valuable. Creating something and expecting to come, I think, is a big ask sometimes when those spaces and those conversations are already happening. Just go and join those parties and start a discussion.